Good evening, everyone. Thank you for being here for today's meeting of the Ottawa Board of Health. Today is the first meeting with all new board members for this term. For that reason, the first item on the agenda is the election of the chair and vice chair. And for that reason, I will be chairing the start of the meeting up to and including the election of the chair. I would like to begin the meeting by acknowledging that we are on unceded territory of the Algonquin and Anishinaabe Nation, and it is a gathering place for many Indigenous peoples. As such, on behalf of the Ottawa Board of Health and Ottawa Public Health, I would like to honor the land and the peoples of the Algonquin and Anishinaabe Nation, whose ancestors have lived on this territory for millennia, and whose culture and presence have nurtured and continue to nurture this land. I would like to extend that honor to all First Nations, Inuit, and Métis peoples, their elders, their ancestors, and their valuable past and present contributions to this land. Reminder for participants, anyone participating on Zoom, please keep your microphones on mute unless called upon to speak. Those participating by phone, please keep the phone on mute at all times unless called upon to speak, and do not put the phone on hold. Please avoid using speakerphone when speaking. Please speak directly into your device's microphone or your telephone receiver. For those participating in person, please keep your laptop or mobile device on mute and use the tabletop microphones when speaking. Please also turn off your laptop speakers. The first item is a ceremonial activity where we will be swearing in the new public members of the Board of Health, and we're joined by Ms. Caitlin Salter-McDonald, Manager of Council and Committee Services and Deputy Clerk. Go ahead, Caitlin.
Merci beaucoup, Diane. My name is Caitlin Salter-McDonald. I'm here on behalf of the City Clerk for the purpose of swearing in the newly appointed public members to the Ottawa Board of Health, who were appointed by Council on April 12th. Ms. Elise Banham, Brent Bauer, Danielle Brown-Shreves, Sabrina Chung, and Tammy DiGiovanni. All members have a copy of their declaration of office, and I will ask you all to repeat after me. Member Brown-Shreves will do hers at a later date. I, having been appointed as a member of the Board of Health for the City of Ottawa Health Unit, do solemnly promise and declare appointed as a member of the Board of Health for the City of Ottawa Health Unit, do solemnly promise and declare que je me quitterai fidèlement et impartialement de mes fonctions au mieux de mes connaissances et de mes compétences. Que je m'acquitterai fidèlement et impartialement de mes fonctions au mieux de mes connaissances et de mes compétences. I have not received and will not receive any payment, reward, or promise thereof for the exercise of this appointment in a biased, corrupt, or in any other improper manner. Not receive and will not receive any payment, reward, or promise thereof for the exercise of this appointment in a biased, corrupt, or in any other improper manner. Que je déclare tout intérêt pécuniaire direct ou indirect conformément à la loi sur les conflits d'intérêts municipaux. Que je déclare tout intérêt pécuniaire direct ou indirect conformément à la loi sur les conflits d'intérêts municipaux. And I make this solemn promise and declaration conscientiously believing it to be true and knowing that it is of the same force and effect as if made under oath. And I make this solemn promise and declaration conscientiously believing it to be true and knowing that it is of the same force and effect as if made under oath. Thank you. Merci.
Thank you. If you could sign the documents before you and someone will collect them from you. Thank you. Thank you, Caitlin. I will now conduct the roll call. Member Banham.
Present.
Member Bauer.
Present.
Member Brown-Shreves. Member Carr.
Present.
Member Chung.
Present.
Member DiGiovanni.
Present.
Member Dudas.
Present.
Member Gower.
Here.
Member Kavanaugh.
Here.
Member King.
Here.
And Member Kitts.
Here.
We have a quorum. Thank you all. Are there any declarations of interest? Hearing none, Can we confirm the minutes of the meeting of February 27th, 2023, please? Confirm. Thank you. Communication items are received as noted in our agenda. Member Benham, could I call upon you to move the motion to introduce reports, please?
Be it resolved that reports titled Election of a Chair and Vice Chair, Chair of the Board of Health Verbal Report, Medical Officer of Health Verbal Report, Ottawa Public Health 2022 Annual Report, Update on Ottawa Public Health's Dental Health Services Program, Emergency Management at Ottawa Public Health Annual Update, Ottawa Public Health's Strategic Plan for 2019 to 2022, Update from Q4 of 2022, Ontario Ministry of Health Accountability and Reporting Requirements, Q4, 2022 Standard Activity Report, 2022 Operating and Capital Budget Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report, Delegation of Authority, Contracts awarded for the period of July 1st to December 31st, 2022, and attendance at the Association of Local Public Health Agencies, Alpha 2023 Annual General Meeting and Conference and Board of Health Section Meeting be received and considered.
Is that carried? Thank you.
Carried.
We'll now move to agenda item 8.1, which is the election of the chair and vice chair. I will open the floor for nominations for the position of chair. In the event that more than one member is nominated for the position of chair, a vote will be called. Member Banham, you have a motion?
I move that Councillor Catherine Kitts be nominated for the position of Chair for the Board of Health for the City of Ottawa Health Unit to be confirmed at the first meeting of each year as required by the Health Protection and Promotions Act.
Member Kitts, do you accept the nomination?
I enthusiastically accept.
Thank you. Are there any other nominations for the position of chair? I will ask a second time. Are there any additional nominations for the position of chair? And I will call for nominations a third and final time for the position of chair. Since there are no further nominations, Member Banham, if you would move the closure of nominations, please.
I move that the nominations for the position of Chair be closed.
Is that carried? Thank you. And Member Banham, you have a motion to appoint?
I move that the Board of Health appoint Councillor Catherine Kitts as Chair for the Board of Health for the City of Ottawa Health Unit to be confirmed at the first meeting of each year as required by the Health Protection and Promotions Act.
Is that carried? Thank you. Congratulations, Chair Kitts.
Thank you so much. And thanks everyone for your confidence. So moving on, I will now open the floor for nominations to the position of vice chair. And in the event that there are more than one member or that more than one member is nominated for the position, a vote will be called. Member Banna.
I move that member Tammy D. Giovanni be nominated for the position of vice chair for the Board of Health for the City of Ottawa Health Unit to be confirmed at the first meeting of each year as required by the Health Protection and Promotion Act.
Member Di Giovanni, do you accept?
I accept.
Wonderful. I will call for any additional nominations. Seeing none, I will call for a second time. Seeing none, I will call for a third and final time. I will call for the close of nominations.
I move that the nominations for the position of interim vice chair be closed.
Is that motion carried?
Yes.
Congratulations, Vice Chair. Sorry. We have a motion to appoint.
I move that the Board of Health appoint member Tammy D. Giovanni as vice chair for the Board of Health for the City of Ottawa Health Unit to be confirmed at the first meeting of each year as required by the Health Protection and Promotions Act.
Is that motion carried?
Carried.
Congratulations.
Thank you all. Pleased to serve.
Okay, so now we will go through the consent agenda, and given that this is the first meeting with our new board, I will just go through a little housekeeping. So for those participating or watching from home who may not be familiar with the process, I will list each agenda item, and for any items where board members don't have questions, concerns, or motions, or that we don't have any public delegations registered to speak, I will ask if the board carries or receives those items on consent. So without discussion, and if you do have questions, just let me know. So item 8.2, Chair of the Board of Health verbal report, we're going to hold because I have a verbal report. Agenda item 8.3, Medical Officer of Health verbal report. We have a verbal report from Dr. Etches. Item 8.4, Ottawa Public Health 2022 Annual Report. Is that carried? Thank you. Item 8.5, update on Ottawa Public Health's Dental Health Services Program. Is that received?
Received.
Yeah, absolutely. We've been asked to hold that item, so we'll come back to it. Item 8.6, Emergency Management at Ottawa Public Health Annual Update. Is that received? Okay. Wonderful. Thank you. Item 8.7, Ottawa Public Health Strategic Plan for 2019 to 2022, update from Q4 of 2022. Is that received? Thank you. Item 8.8, Ontario Ministry of Health Accountability and Reporting Requirements, Q4 2022 Standard Activity Report. Is that received? Received, thank you. Item 8.9, 2022 Operating and Capital Budget Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report. Is that received? Great, thank you. Item 8.10, Delegation of Authority, Contracts awarded for the period of July 1st to December 31st, 2022. Is that received? Received. Thank you. Item 8.11, attendance at the Association of Local Public Health Agencies 2023 Annual General Meeting and Conference and Board of Health Section Meeting. We do have a motion to amend. Do we want to deal with that now? Sure. Member Bannum, do you have a motion to amend item 8.11?
Been a while since I was in person. Whereas members of the Board of Health were canvassed for their interest in attending the Alpha General Meeting and Conference ahead of new public members being appointed to the Ottawa Board of Health. And whereas following the appointment of new members, public members to the Ottawa Board of Health, members were re-canvassed in order to ensure that newly appointed public members also had an opportunity to participate in the event they are available and interested. Following the second canvassing for expressions of interest, 2 members indicated that they are available and interested in attending this upcoming event. Therefore, be it resolved that the recommendation of the report titled Attendance at the Association of Local Public Health Agencies, Alpha 2023 Annual General Meeting and Conference and Board of Health Section Meeting be amended to add the names of members Elise Bannum and Danielle Brown-Shreves as attending at the Association of Local Public Health Agencies 2023 Annual General Meeting and Conference and Board of Health Section Meeting to be held June 13th and 14th, 2023 in Toronto.
Wonderful. Thank you. Is that motion carried? And on the report as amended, carried? Great. Thank you. So we will return to the first held item, which is my verbal report. So tonight marks our first meeting with all new Board of Health members for this term. So I want to take this opportunity to welcome you and to thank you for your interest in public health programs and services and your willingness to contribute your time, your knowledge, your expertise toward guiding Ottawa Public Health over the next 4 years. I think we have a great board and I'm really excited to work with all of you. That said, we have a lot of work ahead of us, including orientation and strategic planning, as well as ongoing training, site visits, and other opportunities to learn more about OPH, its employees, its programs and services, and its vision, mission, and values. Over the last 3 years, OPH has put a great deal of its focus and resources into responding to the COVID-19 pandemic and reducing barriers for people to access information, services, and resources to improve their health and wellness. As the organization now moves to reinstate and adapt programs and services towards its future state, my hope is that over the next 4 years, the Board of Health will continue to support the core work of OPH through strategic planning and a renewed commitment to health equity by advocating for adequate resourcing of public health programs and services. J'ai hâte d'apprendre à vous connaître et de travailler avec vous et toute l'équipe de SPO. J'apprécie les contributions uniques que chacun d'entre vous apportera au soutien de la santé et de bien-être d'Ottawa. Alors, merci encore. At our last meeting, I reported that on February 6th, I made an oral submission to the Provincial Standing Committee on Finance and Economic Affairs as part of their pre-budget consultations. Among other things, I took that opportunity to draw attention to 4 shared priorities among Ontario's local public health units: immunizing children and youth against vaccine-preventable diseases, supporting parents, newborns, and children with essential needs to ensure they get a healthy start in life, supporting public health units to help prevent and limit the spread of communicable diseases, and improving mental health and addiction supports. Last month, the provincial government presented its budget for 2023, which included an additional investment of $425 million over 3 years in mental health and addiction services. Through this much-needed investment, the government is acknowledging the urgency and intensity of need in communities across Ontario, particularly for community-based mental health and addiction services. Local public health units, as well as our many partners, are on the front lines of a growing crisis of homelessness, substance use, and mental health that requires a sustained and coordinated response, especially when it comes to addressing the needs of Indigenous, Black, and racialized communities. Investment like the Ontario government's 5% increase in the base funding of community-based mental health and addiction service providers will have a measurable impact at the local level, for which we are grateful. Earlier this month, I wrote to Ontario's Minister of Health and to the Associate Minister of Mental Health and Addictions to thank them on behalf of OPH and the Ottawa Board of Health for their continued efforts in protecting the health and well-being of Ontarians. And I will continue to advocate to the province concerning other public health sector priorities, including immunizing children against vaccine-preventable diseases, preventing the spread of infectious disease, and supporting parents to give their children a healthy start in life, as well as for a return to the 75-25 funding formula for local public health units. The federal government also presented its 2023 budget last month, featured investments in oral health, including $250 million over 3 years starting in 2025, and another ongoing $75 million for an oral health access fund to address oral health gaps among vulnerable populations and reduce barriers to access and care, including in rural and remote communities. The federal budget also focuses on investments in mental health by promising to provide $158.4 million over 3 years for Canadians to access immediate suicide prevention and mental health crisis support. The federal budget also put a lot of emphasis on data collection and data sharing, and I look forward to more information on how these programs and initiatives will roll out. Part of the board's responsibility in this term will be to continue to inform the various levels of government about public health priorities to ensure they are adequately resourced and, as a result, effective at a local level. Next, I have quite a few events to highlight. First, la Journée mondiale de la tuberculose est l'occasion de sensibiliser le public à la tuberculose et de mettre en lumière les efforts déployés à l'échelle mondiale pour éliminer la maladie. Tuberculosis is still an issue in Canada, with Ottawa experiencing increasing rates of active TB over the past 6 years. There are typically between 50 to 60 cases of active TB a year, and the team at OPH works closely with every individual, their specialist physician, and other care providers to ensure the best possible outcome, as well as working to trace any contacts to prevent further transmission and illness. TB can take between 6 to 24 months to cure, and our TB team is there every step of the way. To mark World TB Day, Stop TB Canada, Results Canada, as well as many other organizations, including Ottawa Public Health, participated in lighting up landmarks in red to support World TB Day on March 24th. The city's own heritage building was lit up in red, as well as several other prominent Ottawa landmarks, including the Ottawa sign in the Byward Market, the Shaw Centre and Connaught Building. OPH social media channels also promoted the occasion and their messaging. La Semaine nationale de sensibilisation à la vaccination se déroule du 24 au 30 avril. Chaque année, c'est l'occasion de sensibiliser à l'importance de la vaccination et de reconnaître l'impact incroyable des vaccins qui protègent les gens contre des maladies comme la polio, la rougeole et la coqueluche et qui sauvent d'innombrables vies. As many children have fallen behind on routine vaccines due to the COVID-19 pandemic, this year's theme is Let's Catch Up with Confidence. The theme is centered around encouraging everyone to catch up on missed vaccinations to help keep ourselves and our community safe. Ottawa Public Health will be sharing and publishing content daily on its Facebook, Twitter, and Instagram accounts. And I encourage my board colleagues to follow OPH's social media accounts, to share this contact with your own followers, and to promote this important week. This year, the first week of May marks the 72nd National Mental Health Week. La thème de cette année est Mon Histoire. Collectively and individually, we have multiple layers and stories that make us who we are. And while each year, 1 in 5 Canadians experience a mental health or mental health issue, all of us can promote mental health. For those who are comfortable doing so, sharing your story can help reduce stigma and raise awareness. Throughout the week, OPH will be providing Stigma, the Power of Language, capacity building training workshops to Ottawa community housing tenant leaders across the city, as well as sharing mental health resources, services, and stories through all social media platforms to reach Ottawa residents. Pour développer et maintenir une bonne santé mentale, nous ne pouvons pas le faire seuls. Des liens sociaux solides contribuent à renforcer notre résilience, à améliorer notre santé physique et mentale, et à nous aider à faire face aux situations stressantes de la vie. Le conseil de santé encourage les membres de la communauté à tendre la main et à partager leur histoire de promotion de la santé mentale avec une personne de confiance. For more information on when and where to access mental health supports, please visit ottawapublichealth.ca/mental health and wellness. May 5th is also the National Day of Awareness and Action for Missing and Murdered Indigenous Women, Girls, and Gender Diverse People. Ce jour-là, nous saisissons l'occasion de nous souvenir des personnes qui ont perdu la vie à cause de la violence coloniale fondée sur le genre, ainsi que de leurs familles et de leur communauté qui continuent de vivre avec le chagrin de la perte d'êtres chers. As part of the final report on the inquiry into missing and murdered Indigenous women and girls that was released in June 2019, approximately 2,800 individuals participated in a truth-gathering process that resulted in 231 recommended calls to justice. Since then, there has been little action on these calls to justice, and the board wants to emphasize the responsibility we all have in prioritizing these calls, both in our communities and our lives, and ask that on May 5th, community members aim to raise awareness about this ongoing crisis and encourage everyone to take action to protect Indigenous women and girls, to speak out, and to promote violence-free communities. Emergency Preparedness Week, which is May 7th to 13th, has been a national event for over 25 years and aims to promote awareness about the importance of knowing what to do before, during, and after emergency. Emergencies can happen anytime, anywhere, and can affect anyone. Toutefois, dans les zones à forte densité de population et dans les régions où l'accès aux ressources est limité, les conséquences sont souvent plus graves. This year, OPH's activities will highlight the importance of staying connected and leveraging the networks of relationships among people within our community as an emergency management strategy. We will concentrate our efforts on providing preparedness information to seniors living in high-rise buildings and to those supporting them, as well as internal communications for staff and their families and social media messages on various platforms. And I want to thank OPH's staff for supporting in the recent ice storm as well. May 8th to 14th is National Nursing Week. I told you there was a lot of events happening recently. And this year we will be celebrating it with two themes. The first from the Canadian Nurses Association, Our Nurses, Our Future. This theme showcases the many roles that nurses play in the healthcare journey of the residents of Ottawa. Every day we see nurses' commitment to engaging with various people and the important role that nurses play in our community. As well, we are inspired by the Registered Nurses Association of Ontario's theme, Change Through Unity and Action, which reflects the strength that comes from the diversity and dedication of our nursing workforce and the population we serve. J'aimerais profiter de cette occasion pour saluer et remercier toutes les infirmières et infirmiers qui travaillent à Santé publique d'Ottawa et dans divers lieux de travail et institutions à travers la ville d'Ottawa. This concludes my verbal report, and as always, I would be happy to take any questions if there are any. Seeing none, is this report received? Thank you. We will now move on to item 8.3, Medical Officer of Health Verbal Report. Dr. Etches?
Thank you. And I think it's maybe doesn't often happen, but I think the chair's report might be longer than my report today. Yeah, I mean, good afternoon, Kwe, Unasukut, Annie, and bonjour. I would like to provide you with an update on a number of initiatives that we are doing, as the chair mentioned, because we continue to see mental health, addictions, and substance use health as a priority. And I'll move on to some other updates, finishing with COVID today, which is, again, you can see the shift and the change. So first, we are working to make mental health supports and resources more accessible to young people living in rural areas. Earlier this month, Ottawa Public Health collaborated with the Rural Ottawa Youth Mental Health Collective to provide suicide prevention training to 30 young members. Et plus tard dans le mois, nous présenterons les résultats locaux du sondage sur la consommation de drogue et de la santé des élèves de l'Ontario 2021. C'est avec les membres du collectif Jeunesse Rurale d'Ottawa afin d'éclairer leur initiative. And another way we're supporting mental health needs of residents living in rural communities is through the promotion and awareness raising of a new farmer wellness initiative from the Canadian Mental Health Association. This new program connects farmers and their families with specially trained counselors who provide counseling and clinical services in English et en français, free of charge, 24 hours a day, 7 days a week. Another new initiative is our Mental Health, Addictions, and Substance Use Health Community Dashboard. It recently launched in its first phase. Une autre nouvelle initiative est le tableau de bord communautaire de la santé mentale, la toxicomanie et la consommation de substances, dont la première phase a été lancée récemment. And it really doesn't do it justice for me to talk about it. I encourage you to take a look at this dashboard. It was, I believe, Member Gower and others of the previous board who really noted that we needed to learn from our use of COVID dashboards to speak to mental health and substance use health in our community in a new way. And so this dashboard provides better information to plan, develop, and coordinate services using a common data set that will track and measure the status and outcomes of Ottawa's population related to mental health, addictions, and substance use health. It's the first of its kind in the province, and it is the result. It took some years, multi-year collaboration of a broad coalition. When you do things in partnership, it takes more time, but you get better results. And so we included people with lived and living experience of substance use. We have community providers of mental health and substance use health services, hospitals, police, paramedics, Ottawa Public Health, and others. And we're certainly engaging, continue to do so with equity deserving groups to ensure that the data are collected and analyzed and shared in ways that reflect community needs and concerns. So among other topics right now at this phase, the dashboard features data about self-reported levels of mental wellness, the harms that people experience as a result of mental health, addictions, and substance use, access to harm reduction supplies and services, and the stigma that people face that prevents them from getting access to services and supports. Overall, we're also looking at access to health and social services, especially for people with greatest needs. So there's extensive and ongoing consultations that have influenced the development of the dashboard, and we'll continue to work on this. And while the dashboard provides information on specific groups, it speaks to people who are living on low income, who are or identify as racialized. There are many data sources where this information is not available, what we call the social determinants of health. And so our work is continuing to influence inclusion of social determinant of health variables in provincial data sets so that we could break down the information into more disaggregated forms. This is important because we do see that inequities exist in mental health, addictions, and substance use health in Ottawa, and they are closely tied to the social determinants of health. Oh, I just realized for those online, you can probably see my chin, so I back up a bit. What we will do is continue to work towards highlighting where there are gaps in the information, and future developments will aim to close those gaps. Et au nom de Santé publique Ottawa, je tiens à remercier nos partenaires et leur contribution à cette initiative. Comme j'ai dit, aussi notre ancien conseil de santé pour s'être fait le champion de notre travail dans ce domaine. I want to also call your attention to the Chief Medical Officer of Health's report from last month, Dr. Kieran Moore. He released a report entitled Being Ready, Ensuring Public Health Preparedness for Infectious Disease Outbreaks and Pandemics. Dans son rapport, il a reconnu les effets dévastateurs de la COVID-19 sur les personnes, la société et le système de santé. Et il a recommandé de s'appuyer sur les leçons tirées de notre réponse à la COVID-19 pour s'assurer que l'Ontario est prêt à faire face à des futures pandémies et épidémies. Dr. Moore advocated for the routine collection as well of social determinants and socio-demographic data, including information on race, ethnicity, and language that can be used to identify communities at greatest risk and work with community members and partners to reduce health inequities. And he called for an end to the boom and bust cycle of public health sector funding. He made the case for ongoing investments to ensure the province is prepared for the next public health emergency. And I can say without reservation that the key findings in Dr. Moore's report resonate strongly here at Ottawa Public Health. Our work and our data collection early in the pandemic highlighted that structural and systemic inequities and barriers that pre-exist to COVID-19 led to an overrepresentation of people who are racialized and immigrants, especially testing positive for COVID-19. Of course, these communities are not inherently more susceptible to COVID-19, but it's the underlying social realities, such as systemic racism and barriers to health information and services, and or participation in occupations without access to paid sick leave that contributed to people's exposure to COVID-19. And while long-term solutions are needed to reduce barriers to health and improve well-being, bringing this information to the forefront has allowed us, as we work, to increase our work in service of specific communities and tailor messaging in more culturally safe ways and work towards decreasing these disparities. So the key is to continuously adapt our programs and priorities to meet evolving needs of the community. And just as Dr. Moore recommended, we are working to make sure that the health inequities faced by Indigenous, as well as African, Caribbean, and Black populations are a focus of Ottawa Public Health's long-term work. As we continue to demobilize our pandemic response in line with provincial direction, our community is counting on us to continue to be equity-driven, prevention-focused, and impact maximizing, just as we were through the pandemic response. And that's the approach we're taking as we develop Ottawa Public Health's new 4-year strategy, which will outline our priorities and guide our work through to 2027. Alors que nous continuons à démobiliser notre réponse à la pandémie, conformément aux directives provinciales, notre communauté compte sur nous pour continuer à être axée sur l'équité, la prévention et la maximisation de l'impact, tout comme nous l'avons été au pic de notre réponse à la pandémie. So we're envisioning a new strategic direction. We look forward to your work to shape that. We are mindful of another lesson from our pandemic response, that we need to build genuine and lasting relationships with partners and residents who will shape effective work with us. The pandemic's taught us the value of listening and responding to our community with humility, respect, and an openness to try new methods and approaches. So we want to build on what we've learned through our pandemic response, especially from people and networks with on-the-ground knowledge about the specific needs of Ottawa's diverse populations. And that's what our team is continuing to do currently, reaching out and listening to our employees, our clients, our partners, interested parties, as we're preparing this strategy for your review and input. We look forward to working with you to develop and finalize these plans for your approval at the June board meeting. In the meantime, Ottawa Public Health is preparing our teams and our structures organization-wide to be able to bring life to our new strategy. With the provincial funding for the COVID-19 response sunsetting by the end of 2023, Ottawa Public Health is working within a fixed budget once again to respond to our community's need and to look at how we deploy staff to priority areas. So for example, when we think about priorities, we're seeing the intensifying pressures on population health that arise from environmental challenges and infectious diseases. In this context, we will build on existing expertise to expand our capacity to address climate change, emerging infectious disease, infection prevention and control, and emergency preparedness and response. Quite simply, we want to ensure that we are prepared for the next public health emergency, just as Dr. Moore recommended. We also see the intensifying pressures on population health that arise from unhealthy places and policies and practices that result in chronic disease and injury remaining the leading causes of years of life lost and death. And we recognize this burden of illness does not impact everyone in our community equally. And that's why we will build on Ottawa Public Health's existing expertise and our unique roles in preventing illness and injury by promoting health and well-being through an equity lens. We will continue to focus on prevention with partners who can help grow our reach in the healthcare system, with school boards, with businesses, and beyond. So I said I would end with COVID, so I'll come to that. I do want to update you on Ontario's latest recommendations for the COVID-19 vaccination. The new guidance was announced earlier this month by Dr. Moore, and it's aligned with the National Advisory Committee on Immunization's recommendations. That is that high-risk individuals receive a booster dose this spring if it's been at least 6 months since their last dose or the confirmed COVID-19 infection. So just to be clear, I'll outline who is in the high-risk groups. There are people 65 years and older, residents of long-term care homes, retirement homes, and other congregate settings for seniors, individuals 18 years of older living in a congregate setting for people with complex medical needs, pregnant individuals, individuals aged 18 and older who are moderately to severely immunocompromised, and individuals aged 55 and older who identify as First Nations, Inuit, or Métis, or urban Indigenous, and their non-Indigenous household members aged 55 and older. So we we understand as people come forward to our clinic seeking these booster doses that they can have a discussion if they feel that they belong to one of these groups. And we're certainly there to work through any individual circumstances people have that is causing them to seek that vaccination. There are people who haven't had a booster dose with the Omicron bivalent vaccine since last September, and they are still eligible for a booster dose if it hasn't been at least 6 months since their last dose or confirmed COVID-19 infection. Alors, nous continuons à recommander une dose de rappel pour les personnes âgées de 5 ans et plus qui n'ont pas encore reçu la dose de rappel depuis le 1er septembre 2022. Si au moins 6 mois ont passé depuis leur dernière dose ou une infection confirmée de la COVID-19. So staying up to date with vaccinations continues to be our best defense against COVID-19. Although respiratory virus in our community has decreased, COVID is still here, and it is still contributing to absences from work, to hospitalizations, to outbreaks, canceled social plans, and of course, most seriously and unfortunately, death. We expect we will see fluctuations and waves of increased activity of COVID-19 into the spring and summer. We maintain our dashboard and people can see the levels there. It does continue to be important to stay home if you're sick, to have employers support those practices, to prevent transmitting illness to others, including people who are at risk of severe illness. So if you have symptoms of COVID-19 and you're at higher risk for severe illness, we recommend that you do get tested for COVID-19 by a rapid antigen test or a molecular PCR testing so that you can seek care. You may be eligible and benefit from COVID-19 antiviral treatment. And while a number of assessment centers have now closed, rapid antigen tests remain available in some pharmacies, and information on accessing antiviral treatment or these rapid antigen tests is available on provincial websites. So a last word on vaccinations in general, as people are thinking about their COVID booster dose, also know that while we're operating clinics for those doses, our clinics are there for many different types of vaccination catch-up, whether that's childhood vaccines or even adult tetanus boosters. You're supposed to have those every 10 years. I see some people thinking about that. So certainly, again, the nurses in our clinics are really skilled at working through, do you need a vaccine? Are you falling behind in your vaccine protection for one of these doses? And I would recommend if people want to talk to a nurse about their child record, our clinics are there for you. So that concludes my report, and I'm happy to answer any questions. Merci.
Thank you, Dr. Etches. I always look forward to your verbal report. We'll go now to questions, and since we have a hybrid format, if you could raise hand on Zoom just to sort of keep the order. Member Banham, I saw your hand shoot up, so we'll go to you first, but if anyone else has any questions, and if you can't do that, you can just wave at me. So go ahead, Member Banham.
Thank you, Dr. Etches, for your report. Between the two reports, there seems to be a lot going on in the city, which is great to see. I wanted to ask about something we talked about previously, which is the slow rates of childhood COVID vaccinations happening, and whether Ottawa Public Health or even Ontario Public Health has a strategy to increase the numbers of children getting vaccinated for COVID-19.
So certainly we find that it's an opportunity for conversation when we're talking to parents about childhood vaccine. So it goes both ways. If people come in for a COVID vaccine, we're asking them about their childhood vaccines. If people are coming forward for childhood vaccines, we are asking about their COVID vaccination status. That's one way we can find out if people have questions or they might have missed that their child's available for a booster dose. In Ottawa, actually, more so than across the province, people came forward for their first and second doses in the childhood and especially youth years, but the rates of the boosting have been lower. So it gives us an opportunity to explain the value of an Omicron specific variant and what's recommended. I don't know if the team wants to add anything to that. Getting a head nod, that's about where we're at. There isn't a provincial campaign that I'm aware of. I think we'll see the province is already thinking about next fall's respiratory season. So it's one of those things you want to plan ahead. So I think we'll be talking to them about their plans and what they are anticipating heading into the next fall. And we know that children definitely had a lot of respiratory illness and challenge last fall. And so maybe it's another opportunity as well to speak specifically to that population's needs.
No more questions? You're good. I don't see any other hands. So can we receive the report?
Received.
Thank you. We will go now to the next held item, which is 8.5, update on Ottawa Public Health's dental health services program. And I believe Member Gower, you had some questions.
Thanks, Chair. Yeah, I highlighted 3 sections. One was something we did discuss about a year ago at OPH, and it was the gap between the reimbursement rate paid under publicly funded dental programs as it relates to private insurance reimbursement. And I was wondering, well, one of the actions we took was, as a city council, we asked the mayor to write the province. And I'm curious if we've had any response or if there's been any change or improvements to narrow that gap.
So our program manager for the dental health and vision health team, actually, Nancy Kennedy is here. I don't know if you could speak to any changes in the rates, and no, there haven't been.
And maybe for newer board members, can you give us a sense of what that gap is and what the impact is on dental health in our community?
Is that it? Yeah. The difference between private practice rates, so the rates that if you and I go under our insurance rates are, it's around 35 to 40% of what, so under the public programs, a dentist that provides service to someone on a public program would be paid about 35 to 40% of the fee, of the customary fee. And that has not changed in years.
I just didn't hear that last part. It hasn't changed in years.
No.
And what impact does that have? Like the fact that people who are privately insured, I guess dentists receive more of a reimbursement compared to public, but what does that mean impact wise on?
Well, that's correct,
Okay.
because they're private businesses. So when they have to choose between a higher paying fee or a lower paying fee, they make decisions in terms of from a business model. So that may mean they see less children or anyone who's under a public program. So it's definitely a barrier in access to care.
And is there anything that our board could be doing aside from writing letters to the province, because they seem to be ignored? Is there any other advocacy we can help support, or is there any work underway by Ontario Public Health Associations to try to address this with the Canadian Dental Association, or in any other way that you're aware of?
Other than the advocacy, it's a provincial program, so they're huge programs, significant large budgets across the whole province. So if one municipality starts to make changes and increases, it kind of puts pressures across the system as well.
Okay, thank you. So I think it's something we'll have to keep following up on.
And if I may add, we certainly see that there are private dental practices that take people who are served under the provincial program. That it's not as many as we'd like. We see the need is greater. Our clinics are able to do their part, but we can't serve the tens of thousands of people without dental insurance in the city. So we have a dental stakeholders group of leaders and dentists who work with us to try to problem solve and think about solutions locally. That's part of what we're doing with children needing general anesthetic, is we're building relationships and looking if we can create ways of assisting private practices to take on more clients. And I would say we're waiting to see also what the federal program will be like. In case that adds, to people's interest in taking more clients, but continue to see that challenge.
Okay, thank you. That was the next thing I was going to ask about was about the new Canadian Dental Care Plan, and the report does note that the details are coming by the end of this year. Can I ask staff to speculate on what difference they think it might make to how OPH operates in the area of dental care?
At the end of the day, there's a lot of work to be done. So, and there's always going to be a role in my experience for public health clinics. We serve different clients, people who don't come all the time, the language barriers. So I think there will always be a role for that type of clinic. What will change will be the level of service, hopefully will be equalized across. Right now we have 7 different programs, 7 different procedures under different programs, fees paid. So it'll be easier if it's one program. That being said, there has been no communication I'm aware of at the coming from the province that there will be any change to the provinces. So the question will be, can the provinces cease offering dental plans, and those clients then will be eligible under the federal? So that's a big question, how that will work in the future.
Okay,
I think the conversations are still happening federally, provincially, so we just aren't in the loop of those conversations.
okay. And the last thing was the risk management section of the report mentions the, I think it's almost 2 risks related to dental x-rays, the lack of supply of film, and then an issue around implementation of a new IT solution. Can we get a bit of a sense of how big a risk that is, or what how that's being mitigated right now until the IT solutions is implemented?
So we have purchased an electronic solution, AbleDent, which is a very common in the dental practice. So we're ready to implement that, part of that, as well as the dental X-ray component. So we're working with our IT partners in the city. That being said, they've got lots of other work as well. So we're trying to prioritize that on their list to get that installed, make the connections between a private practice, and we work off the social services database. So making those links between the two. In terms of the X-ray component, we are working towards the end of May to have that implemented. And then later in the year, we hope we'll get the patient electronic charting on board as well. So the risk at this point is quite low. We've had good response from our IT partners, but we're on them every week to keep that on track.
Good. Okay. Thanks very much, Chair.
Thank you, Member Gower. Great questions. Member Bannum.
Thank you. Member Gower's questions have inspired me. I'm wondering, are there any rules or regulations that prevent Ottawa Public Health from maybe celebrating dentists that see a percentage of clients under the provincial programs as a way to inspire others to join, like a public health gold star?
Again, maybe Nancy Kennedy could speak to how we recognize those who do support our work.
Is the question, how do we recognize private dentists who accept? Was that the question?
Maybe celebrate them to get more to want to participate.
We have an Ottawa Dental Society kind of newsletter that goes out to our local dentists, so over 800, 900 dentists locally, and we regularly have a page on that we talk about our programs and we celebrate. You know, we try to get them to feel that they have a sense of taking care of everyone in the community, not just patients or clients who visit their practice, that, you know, across the community, let's think about what's happening, you know, for everyone who lives in Ottawa. And I would say a private office doesn't want to be recognized in a public forum in terms of getting low income, because they don't want to feed more low income patients into their practice. So it's a kind of that delicate balance of how do you recognize what they do. But certainly we can do it through the Ottawa Dental Society and recognizing what they do. I'm not sure specifically one by one would work, because often you may have a patient that then later on in their life end up on social assistance for some reason. And so they will keep that patient. They've had a long history with that person, and they're happy then to continue the work under lower fees. But for them then to open it up to a lot more people going into their office, then sometimes that becomes a bit more challenging for them.
Maybe it's a strategy that can be thought of in the future that might encourage more people to, just as you said, you know, support the community as a whole.
Yeah.
Thank you.
Thank you, Member Bannum. Agree. I think that's something worth promoting for sure. So hopefully the dentists in Ottawa are listening. Member Kavanagh.
Thank you very much. I appreciate this being raised. I had a motion, I guess it was a year ago, on this, and I appreciate that it's moving forward. It's a long, slow process, but with what's happening at the federal level, I was encouraged to hear that that's moving quite forward. So no, I just wanted to say that I appreciate the update. think it's all good news. I think that it'll be a big savings for the province because I don't know if we have any statistics on it, but doesn't it reduce emergency room visits as well? I mean, by having public health care, dentistry.
We do definitely look at the data and see that people visit emergency departments more frequently when they don't have dental insurance. So there can be that.
Yeah, I think that will be a big difference. So a big bonus for the province. Thank you very much for the update. Thanks, Glenn, for your questions.
Thank you, Member Kavanaugh. I'm not seeing any other hands. Do we have any other questions? No? Okay, so can we receive the report? Wonderful. Thank you. So moving on then, motion to adopt reports. Member Bannum.
Be it resolved that the reports titled Election of a Chair and Vice Chair, Chair of the Board of Health Verbal Report, Medical Officer of Health Verbal Report, Ottawa Public Health 2022 Annual Report, Update on Ottawa Public Health's Dental Health Services Program, Emergency Management at Ottawa Public Health Annual Update, Ottawa Public Health Strategic Plan for 2019-2022, Update from Q4 of 2022, Ontario Ministry of Health Accountability and Reporting Requirements, Q4 2022 Standard Activity Report, 2022 Operating and Capital Budget Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report, Delegation of Authority, Contracts awarded for the period of July 1st to December 31st, 2022, and attendance at the Association of Local Public Health Agencies Alpha 2023 Annual General Meeting and Conference and Board of Health Section Meeting be received and adopted.
Is the motion carried? Thank you. Motions requiring suspension of the rules. Don't believe we've received any. No. Do we have any notices of motion? Seeing none. Confirmation bylaw, Member Bannum.
Be it resolved that confirmation bylaw number 2023-3, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of April 17th, 2023 be read and passed.
Is that carried? Thank you. Any inquiries? Seeing none, we will move to adjourn. The next meeting is Monday, June 19th at 5:00 p.m. Thanks, everyone, and congratulations to the new board members on your first meeting. Thank you.
Good night, everyone.